Hello, dear students. Today we'll discuss about the cell death and the human death. I think you have information about the cell death. How many types of the cell death you know? There are
two.
Yeah. First one, apoptosis,
Necrosis
and
or apoptosis and necrosis.
apoptosis and necrosis. There is quite differences between these processes. The apoptosis, this is programmed cell death. This is the death of the one cell by the programming. Which cells they undergo the apoptosis? There are two types of the apoptosis: the physiological and the pathological. If the cell the cell feels some abnormal environmental factors, abnormal environmental condition for the living, the cell enter to the apoptosis and activated the processes in the cell. Now I will try to focus on the morphological aspects of the apoptosis. Here you see the schematic pictures and the histologic pictures of the apoptosis, and which morphological events occur during the apoptosis. First, the shrinkage of cells, the reduction of the number of the organelles, the damage of the mitochondrial leakage, the condensation of the chromatin, fragmentation of the nucleus, and the membrane bleeding and the change. We discussed with you about the pathways of the apoptosis. There are four major pathways of the apoptosis: the signal transduction, cell damage pathway, DNA damage, and cell membrane damage. I will not today discuss about these mechanisms, pathway, the detail. Here we have schematic illustration of the apoptotic pathways. As you see, the first way is the signal transduction pathway by the environmental-based signals that affect the cells. Then the damage pathway. Then third, the DNA damage, and here you see the mitochondrial damage. All of this process, the results by the activation of the special enzymes that known as the caspase. That the caspase they trigger the apoptosis. What means the caspase? Caspase means the cysteine aspartic acid specific proteins that they fractions during the apoptosis. There are initiator caspase and effector caspase. The main effector caspase is caspase 3. And here you see also the cell receptor pathway, mitochondrial pathway here. And we also focus on the morphology of the apoptosis. As we said that in the first process, first event is the shrinkage of the cells, the bleeding of the cells. That here you see in the ultrastructure under the electron microscopy. Second one, the dark nucleus, the darkening of the nucleus, the condensation of the chromatin, disintegration of the chromatin. You can compare with the normal cells and the apoptotic cells. Do you see here the dark nucleus and the apoptotic bodies? What means apoptotic bodies? The apoptotic bodies is the liver biopsy. We can see here this mummified. We call this mummified cells in the, for example, the hepatitis, the viral hepatitis. The cells they fragmented to the small bodies, small particles. Here we can compare with the normal structure and the apoptotic bodies. You see here the scanning electron micrograph and the transmission electron micrograph of the apoptotic bodies. And these apoptotic bodies are ready for the eating by the macrophage. Because their cell membrane they change and the phospholipid structure change in the apoptotic bodies, and the macrophage they engulf of the apoptotic bodies. So after the death by the apoptosis, this process not continued, not affect to the neighbor cells. Here you see the biopsy taken from the skin. You see here the apoptosis of the one epidermal cells with the intensely eosinophilic cytoplasm and the small nuclei, and this is the biopsy from the liver, the high power of the apoptotic cell. And also under the electron microscope we can find the peripheral crescents in the cells. This is the compacted chromatin. So this slide illustrates the comparison between the apoptosis here and the necrosis. The necrosis, this is the also type of the cells, but this is the pathological form of the cell death that caused by the lethal cell injury. But apoptosis is, as we said, the neat and the quiet. Here also we do the comparison with the apoptosis and the necrosis. For example, in the necrosis appears the swelling of the cells, but the apoptosis shrinkage of the cells. In the necrosis, we can find the disassembly of the organelles and the membrane integrity compromised here, but the apoptosis, the membrane integrity they preserve. Also, the chromatin condensation we can find in the apoptosis, and no inflammatory response develops in the adjacent structures in the apoptosis, but in the necrosis there is the inflammatory response. Another slide, the electron micrograph of the apoptosis and the necrosis. As you see here, the cell damage here, the cell membrane damage, and they affect the neighbor cells also. So as we said, there is also the type of the type of the apoptosis, physiological apoptosis. For example, during the internatal development growth, between the fingers there is septa, but the septa dissolved by the action of the apoptotic process. Also, the growth of the bone, cartilage cells, the development of the frogs from the tadpole to the frog development. All of this process they regulated by the apoptosis, and also here you see the main the list of the diseases that they engulfed with the apoptosis. Now let me discuss about the cell death necrosis. The main causal factors of the necrosis, the physical factors such as the temperature, radiation, pressure, electric, mechanical trauma, chemical agents, the drugs or the medicines, medicamentos, many infections, immunological factors, genetical factors, metabolic factors, ischemic, and etc. There are huge group of the causal etiological factors of the necrosis. As we said, necros meaning from the Greek death. Probably you heard about the necrosity, the cemeteries they called in some cities, some European cities also. There are 4 stages of necrosis, but please don't confuse the stage of necrosis with the types of the necrosis, because during the examination, during the quizzes when we ask from our student that please answer me what about the stages, you know, they answer they say me about the types of the necrosis, but here we discussed about the stages of the necrosis, the process that they subsequently they appears during the necrosis. First, the paranecrosis. Paranecrosis. This is the necrosis like, but it is a reversible process. Degeneration. If you remember, we discussed with you about the dystrophies, degenerations, the parenchymatose or the intracellular, the mesenchymal or the extracellular, mixed degenerations, or the necrobiosis. But some of the degenerative process is irreversible. If you remember, we said about the hyaline degenerations, the hydropic degenerations, but some of them is a reversible process. We call the paranecrosis. But necrobiosis, this is the irreversible, severe degenerative process. Then death, the completely stopping the vital activity of the cell, and the final, the autolysis. Autolysis, unregulated digestion of cell by the enzymes of cells. During the necrosis, then the cell structures they change. They undergo this change, morphological changes. And as we know, the main structure of the cells are the nucleus and the cytoplasm, and also the cell membrane, also another organs also. But we see that mainly the change in the cell nucleus, and also in the cytopathology, also the focusing in the change of the nuclear change. We mainly the diagnosis do the nuclear change. And here you see the normal structure of the normal cells, the schematic illustration. Then the cell, the nucleus, they condensated. We call it the pycnosis, the karyopyknosis. Then the nucleus, they fragmented into the small particles. We call it karyorhexis. And finally, they undergo the lysis. We call the fading. We call it the karyolysis. So you remember the stage of the nuclear change, the karyopyknosis, karyorhexis, and karyolysis. I like this slide that taken from the kidney for the coagulative necrosis, but here we see the what we see here. Who can help me? Who can help me? What we see in this illustration, in this histological slide? Do you hear me? This is biopsy taken from the kidney. Yet here we see the normal structure of the renal tubules. You see here with the nucleus, with the cell borders, with the lumen, with the capillaries around them. This is the normal structure of the renal, the epithelial cells of the renal tubules. But let we compare with these pycnotic cells. Do you see here? There are dark nucleus, the shrinking nucleus. This is the karyopyknosis. Then we do the karyorhexis, not shown here, and the karyolysis. Do you see here? Karyolysis. We found here the cellular structures, but they undergo the lysis, dissolution. Do you see here? And they undergo the hydropic change. After the hydropic change, they undergo this pycnosis, the rhexis, karyolysis, and finally they became to the necrotic. What the morphologic signs of the necrosis? The acellular, structureless, the pink debris without any cellular structures. And you can compare the normal structure of the cells with the necrotic structure. During the necrosis, around the necrosis develops the inflammation. We can see here the necrotic area. This starts from the necrosis, but here this is the bone marrow, a biopsy taken from the bone marrow, and here we see the hemopoietic cells with the sinusoid capillaries, and here the necrosis of the bone marrow, and between them, this is the line of demarcation. We call this the line of the demarcation zone, and here this is prominent with the inflammatory reaction, with the infiltration of the inflammatory cells with the hyperemic blood vessels. We discussed about the stage of the necrosis, about the demarcation line, and there are the types of the necrosis due to the etiological causal factors. We will use the some classifications. One of them, the etiological classification of the necrosis. First, the traumatic necrosis. The traumatic necrosis, they develops under the action of the high or the low temperature. Second one, toxic necrosis, the necrosis of the cardiac muscle cells, for example, under the action of the diphtheria toxin. We'll discuss about it during the infection diseases, or in the tuberculosis in the lungs. There forms the caseous necrosis by the action of the toxin of the Mycobacterium tuberculosis, tuberculin. Third one, trophonephrotic necrosis, very big group of the necrosis according to disorders of the innervation, such as the bed sores. Very big groups is allergic necrosis, that they occur as a delayed hypersensitivity reactions. For example, the fibrinoid necrosis. And finally, vascular necrosis. Another name will say that infection, that they occurs according to completely blocking of the blood supply. But you see another classification of the necrosis. This is the clinical morphological types of the necrosis. There are 5 types of the necrosis: coagulative necrosis, dry necrosis, liquefactive or the wet necrosis, the gangrene, sequestrum, and infection. We discussed about if you remember, the intracellular degenerations. Do you remember about the hyaline droplet degenerations, the hydropic degeneration, and the squamous degeneration? During the hyaline droplet degeneration, we said that this is the irreversible process, and they result by the coagulative necrosis, dry necrosis. For example, here you see the coagulative necrosis of the myocardium, the cardiac muscle cells, or the kidneys, the coagulative necrosis, the dry necrosis of the kidneys, for example, during the toxic nephrosis. The biopsy taken from the lungs, the necrosis of the tuberculosis, the caseous necrosis. Do you hear me? Are you here?
Yes, teacher.
Yes, teacher, we hear you.
Okay. Here, about the tuberculosis as a disease, we'll discuss later in our special pathology courses. But here we're interested about the structure of the necrosis. This is the dry necrosis. But there are another type of the necrosis, the wet necrosis or the liquefactive necrosis. For example, in the brain tissue, mainly they present in the brain tissue, in the intestines, and the dead leukocytes, they remain the creamy yellow pus, because in these tissues there is low metabolic activity, and there the low concentration, low number of the macrophage. This necrosis area, they not dissolve. For example, in the dry necrosis, in the heart, the myocardium, in the lungs, the necrosis undergo the organization. We'll later discuss about this one, and replaced by the scar tissue. In the wet necrosis, here not appears any organization, any development of the abnormal connective tissue, scar tissue, and they became to the cyst, became to the pulse-filled cyst. Here you see the brain infection, the necrosis of the brain tissue, the gross description, and here the histological description. Another types is gangrene. The gangrene also the subtypes of the coagulative necrosis. In some literature, they're not separately shown as the types of the necrosis. There are three types of the necrosis: the dry gangrene, the gangrene, the dry gangrene, wet gangrene, and the bed sores. The dry gangrene often develops during the peripheral artery disease, such as the acute limb ischemia. Here you see the dry gangrene of the foot during the atherosclerosis. Atherosclerosis, this is the metabolic disorders of the arteries for the development of the atherosclerotic plaques in the wall, in the lumen of the large arteries. And during these diseases, the blood supply of the organs, many organs, they affected. Blood supply here they limited, and they resulted by the dry gangrene. The wet gangrene here occurs in most tissues and organs. For example, in the mouth, in the bowel, intestines, in the lungs, cervix, in the vulva. For example, we can show the diabetic foot. But in the slides, you see the wet gangrene of the intestines. Bed sores in the patients that they long time they have the bed regime, they stay at hospitals or at home, and at these patients they develop the bed sores or the decubitus ulcers, the kind of the necrosis. The fourth types of the necrosis, this is the sequestrum. Sequestrum, this is the mainly they found in the bone tissue, in the chronic osteomyelitis. And because in the bone tissue there are low metabolic activity, the necrotized parts, they not replaced by any connective tissue, or they not dissolved by the macrophage, and they stays at the bone tissue and they capsulated. Here you see the sequestrum of the bone, and the involucrum, the newborn formation around the sequestrum, and the cloaca, the opening in the involucrum. The sequesters, they should be removed surgically, because they play the role of the infection source for the patients. Here you see the histological slice of the sequestrum. Here you see the necrotized structure in the bone tissue. And finally, the big group, large group of the necrosis, infection. Infection, as we discussed, they result by the damage of the blood supply, the obstruction of the blood supply. So we call is the infarct, that meaning the stuffed into. The form, the shape of the infection depended on the organ vascularization. In such organ that they have the hilum and they have the regularly damaged blood vessels, the infarct became to conical shape. But another organ, they have the irregular shape. For example, you know from the anatomy that the spleen, kidneys, lungs, they have the hilum, and the arteries after the entering to the organ, they branch to the dichotomically. You remember, for example, the structure of the kidneys. The renal artery enter to the lobar arteries, then interlobar arteries. Do you remember interlobar, interlobular arteries? Depended on the appearance. There are mainly two types of the infection we distinguish. First, the white infection and red infection. White or the ischemic, red and the hemorrhagic. Also, one of the special types of the infection in the myocardial tissue, the white infection with hemorrhagic corolla, with the demarcation line. Here you see the comparison of the infection types. The red as the white. White, as we said, this is the anemic. This results by the occlusion of the arteries in the solid organs, that they have the end arterial supply, such as the kidney, spleen, retina, heart. But the red infection, they related with the venous occlusion, mainly in the venous congestions. In the next week, we'll discuss about the hemocirculatory disorders, about the venous congestions. For example, in the liver, we'll discuss about the nutmeg liver, the blocking of the venous drainage from the liver, and here develops the red hemorrhagic infection. That I will discuss in the liver, in the lungs. Here you can compare the white infection of the spleen with the red infection of the lungs during the thromboembolism. You see here also you can find here the conical shape or the triangular shape of the infection. Let me discuss about the outcomes of the necrosis. First, the organization. What means the organization? The replacement of the necrotic tissue by connective tissue. For example, in the myocardium. In the next semester, we'll discuss with you about the ischemic heart diseases. One of them, acute ischemic heart disease, is myocardial infarction. When the myocardial tissue undergoes the necrosis, there are no any stem cells in the myocardium for the replacement, for the renewing of the cardiac muscle cells. So here, the damaged cells, the necrotized cell, they replaced by the connective tissue cells, by the scar tissue, formation of the scar tissue, and there develops the cardiosclerosis. We'll call it as the chronic ischemic heart disease, as the cardiosclerosis. Second one, encapsulation, the formation of the connective tissue capsule around the necrotic area. Third, the petrification, the sedimentation, accumulation of the calcium salts in the necrotic area. For example, in the tuberculosis, formation of the bone foci. The formation of the cyst in the brain tissue, we discussed. For example, during the hemorrhagic stroke or the ischemic stroke in the brain. In the brain tissue forms the cyst. Then sequestration, we discussed in the chronic osteomyelitis, the formation of the sequestrum. Ossification, the appearance of the bone tissue in the area of the necrosis. Regeneration, as we said, the restoration of the necrotic tissue. Mutilation, the spontaneous tearing away of the necrotic tissue, and the autolysis. Finally, the autolysis, the lysis of the necrosis. We discussed about the cell death, apoptosis, necrosis. Our next classes will about the human death, about the human death. So now we'll discuss about the human death of the human. Why we study, why we teach this topic here with the death of the cell, because he's also the topic of the pathology and the topic of the forensic medicine. There are many similarities between the cell death and between the human death. And now we'll discuss about some general information about the human death and about the death science or the post-mortem science. So the human death is the complete and irreversible cessation of all vital process life in the human body. There are early death signs and the late death signs. And the appearance of the early death signs in the body is an absolute criteria of the statements of the fact of the death. So these signs of the death, or that we call the death signs, they develop after 3 hours after the death. So it's better to examine of the corpse after the 3 hours of death in the pathological or the forensic practice. There is the special study that about the human death called as the thanatology. The thanatos, this is the god of the death. The thanatos taken from the Greek mythology. He was the son of the god of the wars, and after each wars, his father sent him to the war zone to control the situation. And the peoples, they believed that the death depended on the coming of the thanatos, so they called the god of the death as the thanatos. So before this there is terminal period. The terminal period, this is the sudden inhibition, sudden drops in blood pressure, inability. We identified the cyanosis, paleness that derived from the terminal period has the 3 periods also. 3 periods: the preagonal, the agony, and clinical death. The preagonal period, they has the sudden inhibition, sudden drops in blood pressure, the cyanosis, paleness. Agony, this is the struggle. Agony, this is the period before the death that can duration from the few seconds to the few days. And this period we can find the disturbances of heart and the pulmonary functions, the pathological breathing, the pulmonary edema, incoordination of the reflex, the paralysis of the sphincters, conversions. And there is also the one process known as the clinical death. Probably you heard about the clinical death. This is the deepest inhibition of the central nervous system, cardiac and the pulmonary arrest. But they durate the maximum 8 minutes. And by the helping or in some conditions, people they can back from the clinical death to the normal life. But there are 2 types of the death signs: the relative and absolute. The relative death signs include the unmoving body, the absence of the breathing, heartbeat and the pulse in a short time, the circulatory failure, the dilation of the pupils, pain, loss of thermic and tactile feelings, and areflexia, the lack of the pupillary and the corneal reflex. But this is the relatively death. The having after pain, it is not meaning that this person is died. But here you see the absolute death signs that include the apnoea, the spontaneous, prolonged, the permanent absence of the breathing; asystole, the prolonged and permanent finishing of the heart beating, so the continuous dilation of the pupils. As you know, the fact of the death, they are constant by the doctors, by the physicians, and we can check minimum 3 processes. First, what? First, we can check the breathing, yeah, and we also can take the mirror to the nose or the mouth of the patients to check the having the breathing. Second one, checking the systole, pulse, even in the carotid artery. And third, the pupillar reflex. If these 3 facts that we will fixed in the patients that is not factions, we can diagnose the best. And another science also develops, for example, the Beloglazov science or the cat-like science. This is the changing the elongation of the pupil, the Larche spots or the sclerotic spot, the summer Larche or the Larche blows. This opacity of the cornea due to the brightness when the eyelids are left open after the days. That formation of the triangular gray spot, I will show you. So the continuous areflexia is the livorus mortis, the development of the spots in the cadavers, the post-mortem rigidity of muscles, and the very important science, the cooling of the body below the 20 degrees Celsius. This is the absolute best science that we can find. Here you see the Beloglazov science, the cat-like science, and the the Larche spots, Larche blows in the eyes, triangular spots. So let we now discuss about the types of the days. From the life, you know, there are 3 types of the days. First, we can call it as the physiological or the natural days. The people will live many years until the 100 years, yet 110 years, 120 years, 130 years, and they die. For example, in Azerbaijan, during the USSR Soviet period, lived one man. As I remember, he was the 156 years that he entered to the reports book of the genius. The second one, deaths from diseases. We can call it as the pathological deaths. And third, forced deaths. First, the execution. Second, suicides. And third, accident. This is the forced death. Now we'll discuss about the early death signs. First, the livores mortis. We call the livores mortis or the livor mortis. The translation meaning the spots in the cadavers. Why they appear? They develops depending on the blood flow, because as you know, after the death, all of the blood they flow to the which blood vessels? Who can answer me? After the death, all of the blood in the body flow to the. You hear my questions? Did you hear?
No.
Questions? I am repeating my question. To which blood vessels flow the blood after the death? Who can answer me? Are you here?
Yes,
Hajar,
we are here.
Hajar, are you here, Hajar?
I am here, but I don't know the answer.
What kind of the blood vessels you know from anatomy?
Well, you mean like the biggest one, maybe?
What kind of the blood vessels you know from anatomy?
We have different kinds. We have the arteries, we have the veins.
Yeah, arteries, veins, the microcirculatory, arterioles, veins, capillaries. What meaning the term of the artery?
Artery?
Yeah.
Can you repeat the question?
Yeah, the meaning of the term of the artery.
Artery, it's like the blood vessel that transports the oxygenated blood.
I'm asking you about the meaning, meaning of the term. Artery. It meaning that the flow of the air. Before the scientists at this stage also the scientists they search the soul, the place of the circulation, place of the soul in the body. Yeah, where is located the soul, the brain or the body? When they autopsied the cadavers before, I discussed in the ancient period, they found the some tube-like structures, empty tube-like structures, and they believe that the soul they circulated flow by these tubes, and they call it the artery. Then they found that this is not the tubes for the soul or the soul circulation. This is the circulation by the blood, arterial blood. So why they found the empty? Because after this, all of the blood they flow to the venous system, the veins, and the arteries became to the empty. Yep. When they flow to the venous blood vessels in the skin, they appear as the spots. We call this hypostasis, that appear in 2-4 hours after this. Yep.
Yes.
When we press with this spots, the area suddenly turns white. White, because we press to the blood, and the blood they enter to another. They replace the place. Enter. Do you understand me? When we plaster with the fingers, it removes the blood from this area to the adjacent side, adjacent blood vessels, and when we take our finger, they recovers quickly. Also, when we will change the body position of the corpse, the new spots will develop here. The second period is diffusion, stasis, that begins after the 12-15 hours after this. Here, the plasma of the blood leaks from the veins into the adjacent tissues. Yep. When we'll press with the finger, they become the painless and will gradually restore, not the quickly restore. And the final inhibition, the hemolyzed blood penetrates from the skin to the subcutaneous tissue, and they supposed not change. When we'll change the position of the cadavers, they will not change, and the new spots not they develops here. Where we use these libraries for the documentation of the time of the days. If this is the fresh cadavers in the forensic pathology as well, yet if this fresh, if we will change this corpse, it will change also the position and the development of the new spots. Do you understand me? We can also check the types of the days, the how the situation of the days, how the spots develops, because all of the blood flow to the lower part of the corpse by the physical rules, by the rules of the physics. If the corpse stay light in the lens, for example, all of the blood by the gravitation will flow to the lower parts of the corpse, and it depended on the position of the corpse. Do you understand me? Do you understand
Yes.
me?
Yes.
And here you see the livor mortis or the livorus mortis. What we can say about these cadavers? That he died on the back position. Yeah.
His face up.
Yeah. Second early death sign is the algor mortis, the cooling of the cadaver, because as we said that after the death, the body became to the physical substance, and the temperature will depend on the environmental temperature. If the environmental temperature will be low from our body temperature, 36.6, the corpse temperature begins to low. to falls to 1 degree per the 1 hours. If this environmental, the temperature of the weather will high than our temperature, the temperature of the corpse will begin to rise. As we said, if the body has a temperature 20 degree of Celsius and below, this is the reliable death cells. And we measure the body temperature in the corpse by the rectum at the depth of about 12 centimeters from the anal opening. And here you see the diagram of the cooling of the body following death, depending on the times. Next early death signs is desiccation, the drying of the cadavers. That it starts from the places without the epidermis on mucous or the lips, membranes, and eyes. And the lips are getting darker, shrivel, and become more dense and hard. And we discussed about the large blood, large spots, large bloods. For example, the cornea. If the eyes will opens in the eyes, will developments of the spots. And the desiccation, the drying of the cadavers take place on that place that skin is more thin or fingers and others. If the epidermis will damage, the skin dry at place take place double quickly. They will dry quickly. Next, the signs is rigor mortis, the cadaveric rigidity. After the death, the muscles in the troop will relax, become soft and pliable, and after some groups of the muscles they continue because for the starting of the muscle development, the sarcomeres need to the ATP. Also, during the death, all of the ATP molecules they dissolve in the body. Yeah. After the death, all of the ATP molecules they dissolve in the body, destroyed in the body, and which the muscles they continue, they contracted during the living situation, they will continue the contraction. So we call it the rigor mortis. Mainly they depended from the mandibular, from the muscles of the mastication, and they continue to the all of the body, and it stops by the coming of the autolysis. Autolysis is the self-dissolution organs and the tissues under the influence of the catalytic enzymes, without the presence of microorganisms after this, because we will now discuss about the later the signs that we will see that the troops, the cadavers, also they dissolve by the under the action of the microorganisms. So now we discuss about the late death signs that include the putrefaction, adipocera, mummification, maceration, and pit tanning. What means the putrefaction? The corpse decay, and they start under the action of the bacteria. So there are some signs of the putrefaction. One of them, greening of the corpse, that begin in the area of the right iliac fossa, in the arterial wall of the abdominal abdomen, and here forms the yellow color. Why? Because the hydrogen sulfide from the gases that released by bacteria in the gut, they penetrate into the skin vessels. Here they join with the hemoglobin and forms the sulfhemoglobin, the yellowish. Then the microorganisms they enter to the veins, spread and rot the blood. We call the desalinate. Then during this process, they separate the gases, and these gases, they accumulated in the subcutaneous tissue, and the corpse gradually swells and grows. We call it as the corpse emphysema, and as a result that the tongues, we can find the protrusion of the tongues, and post-mortem vomiting may occur. Then these blisters, they occur under the epidermis, and this serous blood in color, and the change in livor mortis, or the livorus mortis. Here you see the net, the putrefaction of the corpse. You see here the green color in the venous of the. You mainly will discuss this process in the forensic medicine, but also we teach you another one, adipocera. Yes. The saponification, the adipocera. This is the original troop transformation, which found in most our awareness conditions and lack of oxygen. Okay, so when the troop located in the humid soils or in the small reservoirs with the weather slowly flowing down the water, the pond, the well, we call the saponification. Another condition is the sun is mummification. This is the natural mummification, when the troop found the dry air attached to the good ventilation, then the rotten cases quickly loses moisture and dries. For example, when the troop will located in the deserts and others. Mummification can be general and partial, and maybe natural and artificial. Artificial you saw in our department of anatomy, probably. Here also you can see the natural mummifications. This is the artificial mummifications. In the Egypt mummy also you saw, but here you see the artificial. Here you see the natural mummification. The troop became to the mummified. And maceration. Maceration. This is the change in the skin that occurs when the corpse remains in the water or the wet environment. For example, the waters. In the troop, we can find the symptom of the laundry's hands, the wrinkling of the skin, or the gloves of the days. And then of the third week, the epidermis is stripped. And finally, the pit tanning. Pit tanning, when the troops they located in the soils with the big contents of humus acids into the pit bog, and the corpse acquires the darkly brown color as if tans. Yep. And from there the names of this we call the pit tannings. Okay, so now we finished our today